Your worth has nothing to do with the way you look. It's okay to look your best version, and that best version can be subjective to you. I feel it's very important for parents to understand that there is a difference in skin hygiene versus understanding skin care for self-worth, and that boundaries have to be set.
The impact of sleep and stress levels on your skin is directly connected.
When acne is growing, it's like between two cells stuck together. So when you pick on it, you're only spreading that infection to the neighboring cells. Detoxification are primarily through the liver, and optimizing liver function becomes essential. We should look towards longevity as the new medicine and understand truthfully that longevity lies at a very deep cellular level and it's in our control.
Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle.
Dr. Sonali, it's a pleasure again.
Thank you so much.
Third time, I mean, by public demand, everyone wants to hear what you have to say about skin, and all the knowledge that you shared in the last podcast have been absolutely phenomenal. We've had people around the world writing in to express their gratitude with the simple points that you shared, especially for parents with children, young girls going through PCOS. So thank you for your valuable time again today.
No, the pleasure is on mine. And in fact, thank you for having me, because it's so great to be on a platform where your information is rightly translated and also shared with the correct audience which might need help. So I think that's what we're all trying to achieve by this.
Thank you. The whole idea of the show is to reimagine your lifestyle.
True.
Again, there's too much of information, some of it great and some of it harmful information going around in trends and fads. And while you've had adults misusing this information, today we have teens and, even children misusing this.
Yes.
It's not uncommon to see the amount of children in, cosmetic stores today being allowed to buy a ton of cosmetics.
It is shockingly, I actually find it quite saddening, because I would say the average age of individuals who came to me to start skincare must have shifted from someone being traditionally 14 or 15 to as early as anywhere between the age group of 8 to 11. And as a dermatologist, it becomes very hard, because physiologically, a child's skin, especially in the preteen, is still not an adult skin. So when you see adult products being used in skin at that age, you know that it's way more harm than benefit.
No, thanks for explaining that. So we have a large number of moms who will keep messaging us, and they bring their daughters for treatments to us. And then at the end, they'll say, so what are the skincare products that we can use? Don't worry, it's organically.
Yeah.
It's chemical free. And they'll put some brands that they've flown from different countries. But the point is, I have the same understanding. There's a time and place for everything in life.
Yes.
And with the amount of cosmetics and with hidden ingredients and ingredients which most people can't even understand. So I did this experiment with a mom. She brought me a product. She had purchased it, I think, in Singapore. And she said, hey, Luke, this is organic. I said, read the label. She couldn't pronounce half of the ingredients, half of the chemicals. I said, stop right there. You don't even know what you're putting on your face or your child's face.
And I think it's now what has become popular as this Sephora effect, right? With young girls throwing birthday parties at these beauty shops where they're just buying makeup, and it's a trend. And look, what bothers me, even though being a dermatologist, is that this trend doesn't get limited to face. It is a generation you're raising with a whole new definition of what self-identity, self-worth and beauty stands for. And that's where it's concerning, because skincare is now translating into self-worth. And that is a very, very groundbreaking conceptual change that we're making for our generations to come. This is that age where a child finds identity. And if that identity is going to become synonym with beauty, it's a very deep-rooted problem you're dealing with, right? If any child has a skincare concern, I would encourage parents to see the dermatologist and take guidance. I'm not saying that you don't start at the right age. The question is to understand that physiologically, a child's skin, a preteen skin, is 30% thinner in that topmost layer, which is your stratum corneum. They are also exfoliating, that is regenerating 30 to 40% more than an adult skin, which is why they have that plumpness, they appear hydrated. Their natural oil activity is much lesser. Their glands are prominent and they're not under the hormonal influence. That axis has not been hit yet, the hormonal part. And so the skin is operating very different from an adult skin. So if you are going to use harsh exfoliants, you're going to use chemicals, and you're going to use even makeup laden with these chemicals on that skin, you are setting the foundation wrong. You understand? So the skin is definitely going to be more hyper allergic as they grow. They will have way more sensitivities to products because it's been exposed to their skin when the barrier was not intact. So the skin will start reacting. Secondly, when the skin doesn't need exfoliation and the child is exfoliating their skin, you are losing that essential water barrier which is needed to keep the skin radiant, plump, and more important than anything, it's needed to protect you from the external environment. So using strong face washes with actives, using exfoliant scrubs, using chemicals, whether it's your AHAs or BHAs, salicylic acid, niacinamide, that is not for a pre-teen age group, not for a skin that doesn't have a problem. These are treatments which needed to be directed for skin with problems. Here you're treating, it's like when I treat an aged skin, right? It's weathered land. It needs restoration. We are working for your collagen. We are working for your fibrin. Preteen skin is like pristine and pure. It's like a land where you are using harsh chemicals where something hasn't even happened yet. So you're preventing the skin from coming into its natural worth. So I feel it's very important for parents to understand that there is a difference in skin hygiene versus understanding skin care for self-worth. And that boundaries have to be set. They have to be set because you will not only imperatively affect the quality of the skin, but you're also affecting the way a child is perceiving themselves.
Yeah.
You're giving them a mirror to find their flaws.
I love that you brought this point up because I think we are living in a culture where most people's self-worth is damaged across ages.
True.
And I think at this very young age where they should be able to embrace their flaws as teens, we grew up with pimples and our life wasn't focused on the pimple. We lived around the pimple. Today it's focused on that. I know young girls who will not go out of their homes with a pimple on their face because they see their parents doing the same thing. The mom has a pimple and she's decided not to go out because, hey, I can't cover it up with makeup. So the point is, I think we have a bigger problem over there.
It's a big problem. And it's what you said rightly. I'm not saying don't take treatment for a condition that needs treatment.
Correct.
The point is to understand when you need treatment and when you just need skin hygiene. So you can encourage your children to use good sun protection. You can encourage them to use a good cleanser that is meant for their skin type. You can encourage them to use a good moisturizer.
That's what I wanted to ask.
You can ask them to use a good lip balm. But this is very different from encouraging someone to use lip tints, use shadows to cover their dark circles, use concealers on their skin, or use tinted sunscreens. Why would you encourage a child who's 8 to 10 to use a tinted sunscreen? They should not know the meaning of covering a flaw. Because if you don't teach it to them then, flaws are only going to keep increasing as you age because it's perception. Beauty is always your own perception. So if you don't set that foundation from the beginning, it's a very hard call. And I feel, especially as a mother and seeing in dermatology, that's one advantage you get to see, that you see skin of all age groups. And skin is changing physiologically from birth till old age, right? And a newborn skin is as fragile as a geriatric skin. And there's a skincare which is needed for them. A preteen skin is the skin when it's in its maximum benefit because the hormones have not started causing havoc. And I feel that is the time the child should have the advantage to not worry about it, to not care about it. Because once the havoc hits, there will be acne, there will be issues of other hormonal things which will reflect on your skin. So I feel starting at an age where it doesn't need fidgeting, you are disrupting it even more for what is yet to come. And that's very important to be communicated.
So about this point, and that's why I love having you on the show because you are a dermat and you will speak your work and your expertise, but you also speak about, boundaries.
Yes.
There's boundaries for everything else. So a sunscreen, a moisturizer, a lip balm, and a great face wash is all they need without an exfoliant.
Without an exfoliant. Exfoliation at that age is not needed. I said the skin is doing it for you. It's regenerating 40% faster. Look at any child. They have that plumpness. They have that natural effect. But at that age, if we start teaching children, and when I say sunscreen, I want to clarify, I'm not saying put sunscreen to protect your child from getting tanned or from getting a shade darker. I'm saying put sunscreen for the sake so that they don't develop the solar damage. Because we are living in a highly ozone affected, it's depleted now. The environment is depleted. Your UV rays are much more harmful to protect you from that damage. So I think that communication has to be very clear for why we are encouraging it. I feel that if you are telling kids that it's okay, and there was a time when kids played with pretend makeup, right? We were young girls, I'm sure I've done it myself. But going from that pretend makeup to actually using chemical actives on your face, there's a huge difference, and somebody has to set that boundary because you cannot normalize it. It is not normal to have a birthday party at 8 and go buy makeup. And I say this as a mother and as a dermatologist. In both ways, it's not normal at a very deep-rooted level. And more than anything, it's damaging. More than benefit, it's going to damage your child's skin for the future.
I'm not against makeup. I think it's a beautiful thing when people have used it at ages. But correct me if I'm wrong. I'm asking you a very neutral question. I've seen some girls, women with great skin. They don't need it. They use it. When they go for parties, they look pretty. I've seen some people who have overdone it, and then without makeup, their skin's actually appearing duller.
True.
I don't come from a judgmental fact, but is this possible? Because I have a curious mind and I always look to see what the effect of too much of chemical will do.
Yeah.
Their faces look a little bit duller. And then after a while, I'm imagining if I've noticed this, what do they see in the mirror? Which means either more makeup or keeping it on more consistently through the day.
I think it's what you said, right? So I obviously am not against makeup. I use it myself, but it's about using it and knowing why you're using it, right? That's where the big question comes. And makeup has traditionally existed, right? Yeah. Cleopatra used rose petal. Yes, the tribes have used it. It's always existed as a sign of enhancing. Yeah. But what it traditionally did for you was a simple rule of physics, which is camouflage and reflection. It's physics. So you put a layer, the light reflects in a different manner. So you look more radiant, you look more luminant, and your marks get hidden. Usually, typically a concealer and all of this. But when you will see somebody without that reflection is lost. So the luminescence is there. And there was a trend where people slept with makeup because they didn't want their husbands to also see their skin, right? Mad Men, these shows have shown it. So that concept has existed, which is why I say that this is very deep rooted. So now when women are coming out with being more bare, people want to show their original skin on camera filters, people want to see what it looks like. I think it's great because it's not just about a mother accepting her stretch marks and showing that as a sign of survival. It's also you accepting your skin and accepting that healthy skin can also still have a few flaws. But as long as there's no disruption in your barrier, you're not suffering from a clinical disease like, let's say, an autoimmune disorder, or physically suffering from a bacterial infection which is reflecting as acne, a healthy skin, you might just have few enlarged pores. But if there's a good luminescence to your skin, there's radiance to your skin, that is healthy skin, and there's nothing to hide. There's nothing to hide.
And a natural smile.
And a natural smile, of course. So I feel that makeup industry, of course, has bloomed because people have become way more self-conscious. And I think at some point when I look at young girls using makeup, I do feel whether even as a communication, as a dermatologist, we went wrong to explain that taking care of your skin means self-care. What it meant was it never translates into self-worth. Your worth has nothing to do with the way you look. It's okay to look your best version, and that best version can be subjective to you. And I feel that the more and more young girls are associating it, and they're going through peer pressure. Like if mothers are telling me that if my child is not using a particular brand of makeup, they are being literally bullied in school. As a generation, we all should be worried that what are we doing and what are we raising and where have we gone wrong in that communication. And I personally feel that, not only as a doctor, but again, because as a mother. And that's something to think about.
Now, thank you for being so honest about that, especially as a dermat and a mother. I wanted to ask you because the current pollution is affecting all of our lung patients. We've had patients who have been, living with their ILDs and their issues, but the last 3 weeks, I've seen them come back after 7 years with all the symptoms. I have also seen a whole load of patients coming up with new skin issues. I met one of them yesterday and she said, Luke, I was in Bali. My skin was clear. 24 hours after landing in Mumbai, I got everything back. I would love for you. There's a reason I'm asking you to do this because we've politely reached out to the Prime Minister, our Chief Minister for help. Like, listen, this is becoming a serious problem. And they are listening to us. They're giving us the platform to listen. So we're grateful for that. I would love for you to explain the impact of the air that we breathe, that falls on our face, the kind of contamination, the polluted air on our skin.
I think the AI index has affected us in many levels, but primarily because your skin is your largest organ, it can sort of reflect internally as well. And when we look at pollution as an aggravator for skin conditions, the first thing is that it's blocking your pores, right? That's where it starts first. But importantly, what also happens is that these allergens that you're breathing and are being absorbed through your skin are setting up as foreign bodies for your immune system.
Correct.
And it sets on the process of inflammation. So you start going through the cascade of autoimmunity in your body. Allergies, allergic rhinitis, eczemas, asthma, it's all exacerbated because of this system. But what happens is that when there is an exacerbation of your immune system, the first thing that you might end up seeing is increased flushing on the skin because your blood vessels are dilating. Patients of rosacea have seen worsening of acne, skin irritation that's disrupting your microbiome. And that leads to worsening of pretty much everything in terms of skin conditions. And I feel that taking supplements, avoiding, following a healthy diet, yes, these are contributory, but you can't change the fact that you're still breathing that air. And we can have a humidifier in our room, but you can't change what you're breathing everywhere you step, right? And it's affecting you at a very cellular level. So even with your cellular level, there have been studies which are showing that your mitochondrial energy is affected. So there's less cellular detox available for the skin. So your cells are not being able to regenerate. So accelerated aging. There are multiple side effects which have shown. The only acute ones are getting highlighted.
Yeah. No, thanks for explaining that. Of late, on our programs, we get to see a lot of, beautifully aging senior citizens, 84, 85. I spoke to an 86-year-old lady in Nairobi last night. And throughout the call, I just couldn't help noticing her skin, how perfect it is. My mom, 74 years old, lives in Goa, the trashiest diet. I'm ashamed to say.
Yeah.
I don't know, I always keep saying I want to study her body later in life, how she can just live on, she eats food, but it's mostly chips and stuff. But her skin, unbelievable. As we come lower and lower, and I'm noticing a commonality. These are women who have gone beautifully through their menopause.
Yes.
No drama and perimenopause, no hormonal issues. They didn't even know when it ended. One fine day, they realized, I'm not got my cycle for 6 months, and they're in menopause. And I noticed a correlation of these women with beautiful cycles and their skin later on in life.
Yeah.
Can you explain the correlation between this? Because none of these people are doing what our generation
is doing. Yeah.
They're not. The most is they put makeup before a outing or a party or something like that. But that's it. They don't have even, a lot of them don't even use moisturizer. So I want you to explain
I think you said the answer yourself, honestly. One, of course, the environment that they've lived maximum part of their life is very different from what we are living in. Secondly, they didn't load their bodies with xenoestrogens. They traditionally drank out of wooden, not wooden, matkas. They rarely ever had the concept of using makeup. They rarely ever laden their skin with synthetic moisturizers. Everything was natural. Maybe it was a pure coconut oil that was used. Half of the women have been using coconut oil on their skin for the longest time. And at that time, they could do it because the pollution in the air was not what it is today. So they didn't have grime sticking to them, right? And what I feel is the levels of stress that they went through were very different and their circadian rhythms were very set. When you traditionally think of it, do you ever remember your mother getting up late or your father getting up late, right? They followed a lifestyle. They followed a routine. I used to remember, and even till today, my father is up at 5 a.m. playing golf. He gets his dose of sunlight naturally into his eyes. He has that perfect circadian rhythm going for him, and that's what they all lived through for their major part. They didn't have social media distracting them. They didn't have television which kept them up late at night. So their melatonin pathways were set. I don't think insulin resistance was where it is today in that generation. So they didn't glycate. And that's what brings me back to the aging. So when there was no muscle glycation, of course their aging was more graceful. We are glycating in our 30s and 40s. We are going through changes which they will go through in their 60s and 70s. So look at it. Look at the decade. And this is what I say. If we don't lay the boundary, these kids are going to hit it much before any of us. Because they even have the factors of diet with them, which is not in their favor.
And do you think, because of late, every senior citizen that I speak to, 80, 85, 90, I always ask them, what are you all doing differently? They just have one piece of advice. Listen, just be happy.
Yes.
They're stressed, but be happy.
They've all handled stress. They've always handled stress. But I feel that their hormonal regulation was way better than ours. And I think that's why women didn't hit menarche early or go into menopause early also. Look at the age of people who are getting early puberty. now, onset, whether it's women or men, irrespective. And also women who are going through perimenopause so much earlier, because I speak, and menopause is something that brings a lot of changes in a woman's skin. So I get to interact with a lot. And I believe at least that I would probably be in the perimenopausal age myself, because you go into it 5 to 7 years before you'll ever hit menopause, right? And I feel that this generation is experiencing it way before than any of the others. Now, they probably didn't take much of the things, but the foods they ate were probably much richer in magnesium. They had natural zinc. They made sure that they gave their body time to recover. And as I said, I insist on the circadian rhythm, because I know that the female hormones are greatly dependent on that rhythm for their detoxification. And they probably didn't also have many factors of lifestyle abuse, which we have access to.
Correct.
So their
They
livers were
smoking,
their liver was way healthier than us. So they were detoxifying better.
I love how you keep talking about the liver, because everyone thinks that the face is only like what we put on the outside.
Yeah.
But the liver plays such an important
Way
healthy
more
skin.
important. I think that it's often overlooked, and I like to believe that it's the new liver skin axis. How everyone talks about the gut skin and the brain skin. I think it's the liver skin axis, because hyperpigmentation, melasma, something that is bothering a lot of people. Usually you see the onset post pregnancy, sometimes post-menopausal, or in your 3rd and 4th decade. This is where it's most commonly onsets. And then it's like a mask, right? Because there's a pigmentary patch on your face, and it's very bothersome aesthetically as well to anybody. And we've been treating it, but I think at some point you started feeling that the creams are the only way forward. Maximum you could think of was vitamin C, adding antioxidants like glutathione. But lately, a lot of research has shown how much the liver detoxification pathway plays a role. And it makes sense, because estrogen, everyone knew that hyperpigmentary disorders could have something to do with your estrogen metabolism. But that metabolism is primarily happening through your gut and through your liver. And if either of these are compromised, whether it's gut dysbiosis or your liver is not functioning to its optimum, the pigmentation gets worse. And when you think of it, look at a cirrhosis patient, look at a jaundice patient. Where do you see the
dark skin?
You see paleness of skin, dark skin. That's the first. So it actually makes sense, because the pathways of detoxification are primarily through the liver, and optimizing liver function becomes essential. And when we talk about optimizing liver function, I'm not saying you have to do something complicated. It's a simple thing of balancing your insulin, balancing your leptin, simple herbs like milk thistle, dandelion root tea, which are very beneficial. And I feel like, I think what you are doing is great, because sometimes being an allopathic practitioner, I might not know which is the best sourcing. And when I say organic, is it truly organic? And I feel that with someone with your expertise, if there is someone who's checking this, it becomes easier, because it's very easy for me to come and say, take milk thistle, but I should also be sure that the person is getting the right source and the body is absorbing it correctly.
That's a great point, doctor, because we've had that struggle with our patients. Today, doctors are so much more, a lot of doctors are so much more educated and open to things beyond medicine.
True.
So sometimes we've had doctors telling the patient, yep, you can start milk thistle, you can start dandelion root. And when these patients come to us, we started wondering, what do we give them?
Yes.
Which brand do we trust? So that's why we launched the Pink Tiger, because we said we want to do a third-party verification, and I can't tell you the amount of filth going on in our country.
I can only imagine.
With some of the biggest brands. Anyway, we don't want to.
No, of course.
Put down brands,
my point is that you are giving access to the right choice
Yes.
As a consumer and as a prescriber, because I think I would like to believe I'm both, because I also believe in consuming what I prescribe. But for me also to choose the right thing, this is maybe not the best place where my knowledge would extend, right? I would know what it does, but I'm not the best person to tell you which is the correct brand. So if there is someone with your credibility doing it, I think it makes it easier. And I think it's very important for consumers to also know what they're taking. And, coming to this same point, I think we have stresses which we don't identify. See, like these, right? Like a simple stressor factor of what you're eating. Like everyone is like, no, it's farm to table. But it's become a stress factor, even in today's person, to know whether what you're eating is healthy.
And we shouldn't have to be stressed.
We shouldn't. And this affects your cortisol, and cortisol affects your insulin, and we're back to aging. So when you look at traditionally, even my patients tell me, oh, my grandmom didn't do anything, and look at her skin, doc. Why do I have to use this? I wish I could explain to them that it doesn't just stop at creams. You have to consider the whole lifestyle they live, You have to adopt it. It's what blue zones are. You read any book about blue zones, I don't think that concept of cortisol or insulin spike exists there because the lifestyle was so different.
No, I love that you talk about that, because I think you keep mentioning stress and sleep. And I mean, we just see it. We have, our clients who have skin issues or gut problems, and then they're suddenly on a holiday and they're sleeping well, and they say, "Oh, look, I'm glowing today. I'm in the Maldives." And I'm
True.
like, yeah, the air, but you also slept well. And the impact of sleep and stress levels on your skin is directly connected with each other.
Yeah.
So we keep telling people you can take all the creams, all the serums, but it's everything like you say.
No,
you
no.
have to do.
In fact, I'll tell you about a very interesting case study that I was studying about. And it showed that tryptophan is your main thing which you need for your melanin as well as your melatonin, right? So when we deprive ourselves of sleep, of our circadian rhythm, that acid is going to get pushed to produce more melatonin and the melanin suffers, right? And you get more prone to your pigmentary disorders. So this study did supplementation of tryptophan for pigmentary patients, and there was an immense improvement in their pigmentary disorders just with using that particular and encouraging foods which are rich in tryptophan. And the other factor which I feel is that with sleep, that, people are wearing biohacker devices, right? Like you're using the Aura ring, and it's that specific to tell you that how you are regenerating, because it's literally pointing out to you that this sleep, though you might have slept for 6 hours, but it's showing you that you didn't go into deep sleep. So you didn't really synthesize your growth hormone. You didn't really need the sleep that your body was demanding. And that's because before sleeping, I don't know how many of us are sticking to not eating for 4 hours, not using a device. And it's hard. It's hard, I agree, because that's what life has become today, right? But if I'm spiking my insulin just before I go to bed, my cortisol can't not get elevated. And then if it's elevated, I can't go into deep sleep. So it's just so interrelated that for me, sleep is absolutely integral.
No, thanks for stressing on that. That's our favorite subject as well. Coming back to senior citizens, if they want to start off with, hey, we want to start looking after our skin.
Yeah.
What would you suggest to senior citizens? An easy way, if let's assume they don't have any health problem or whatever, but they just want to look after, because listen, they have the same access to air.
True.
Everything's changing,
True.
quality of food. So what routine would you suggest for them?
So, honestly, with senior citizens, I feel like I would like to take care of their skin like I take care of a baby's skin, because they also are losing a lot more water. The barrier has become weaker and there's much more collagen breakdown. So pretty much concentrate on these 3 things. Diet-wise, I want to ensure that their protein intake is apt, because muscle is your main organ of longevity. Once that starts to break down, that's when you see it, right? Secondly, supplementing them with anti-inflammatory, because the body is producing a lot more free radicals with the aging process, with the glycation, so omegas. A lot of old age people also notice weakness in their barrier, and they also notice changes in their taste. And surprisingly, zinc is one supplement which helps. Coming to the extrinsic part, pretty much re-emphasizing on what I said, rebuilding the barrier. So using humectant creams which would trap the moisture. Something as basic as even a liquid paraffin and glycerine added to a moisturizer can amplify the effect of that moisturizer for their skin. Liquid paraffin socks and gloves are available, because you'll see that skin becomes very papery thin. So they are much more fragile and more prone to bruising. That's something that I encourage. And of course, age spots increase. So sunscreen actually is a mandate even for geriatric skin. And one thing which I love is, and I always encourage, is oil bath and rice kanji water. What I say for babies. Because putting oil and having bath in adult skin will prevent that water loss and dehydration of skin when they are bathing. So using a bath oil is extremely beneficial, or traditionally applying coconut oil before having bath. And rice kanji water is super rich in ceramides. It's one of the richest source. So a rinse of rice kanji water, even for people who have psoriasis, xerotic skin, I encourage people to do this.
So can you take us through the process of having this oil bath? Is it that you apply the oil first and then the soap and water, or
no? So the thing is, the point with the soap is that it changes the pH of your skin and can further dry off. So when water dries off your skin, it's evaporation. It's the process of evaporation, but it's also pulling some water from your skin, and which is why bathing can dry the skin further. So what I recommend is that you apply the oil, and oil baths usually emulsify into soap. So when you put water, the oil becomes a soap and gets washed
So
off.
the oil bath is like a product which is
It
made
is,
for
it
that.
is.
Oh, that's
Yes,
interesting. I
yes,
didn't know that.
yes. So I think that's truly beneficial in children and adults. And as I said, with adults, I always say take care of your internal health as much as you take care of application. And I say this for everybody, but in adults specifically, protein becomes very important.
So, doctor, coming to teenagers and acne, can you touch upon the topic? I know
Of
in our
course.
previous episodes we spoke about a hormonal imbalance, we
Yeah.
spoke about sleep, food, junk, all of those things. If they have acne, what's the best way to start looking at this? What can they start doing as first steps, and what should they not do in order to kind of really get better and handle it right?
I think it stresses a lot about what we were speaking earlier, that now the onset of puberty has significantly happened earlier, at an earlier age. And when puberty will hit, your body is going through a hormonal havoc till the body starts to understand. And pretty much 1 to 2 years before is when it all starts happening, right? When you're getting the signals that these hormones have to start releasing in the body. So what I feel is that the first step when you notice is probably blackheads and whiteheads before it becomes an actual bacterial infection and will result in acne. And nipping it then can be very helpful. That's why I say that using the correct skin hygiene is important. So choosing the right cleanser which will balance the pH of your skin, which will make sure that it's not stripping it of its natural ingredients, is very beneficial. However, because acne is bacterial, and at that age you could be very prone to picking on your acne, which can lead to scarring, I feel that taking the advice of a dermatologist is essential. But as parents and even to young girls who are listening, it's important to understand that when acne is growing, it's like between two cells stuck together. So when you pick on it, you're only spreading that infection to the neighboring cells. And the same thing happens when you exfoliate. So exfoliating on acne is a bad idea. Using salicylic acid ingredients without knowing and how to use it, you can actually develop a burn. Using some patches which are becoming very popular, I am not at all in favor of, and a lot of young girls do it because that again is too much delivery in one spot and can actually give you skin burns. So I feel that taking the right antibiotics or antibacterial cream is important. Having said that, a lot of acne is seen with hormonal disturbances like PCOS, PCOD, and these have become too prevalent. So it's very important that it is diagnosed at the right time, and this is where your blood work becomes important. And I'm saying this on your podcast, Luke, because a lot of mothers find it hard when they come to see me with a young girl of acne, that why is the doctor making her do blood tests? But you need to understand that everything I say is a hypothesis till I see it in my blood work, because that's my blueprint. That will actually show me where the problem is going wrong. And you'll be shocked that the new trend is not just insulin resistance, which is setting the PCOD, it is also leptin resistance. And sometimes it's so important to just treat these two, get them on the right lifestyle choices, and make sure that the gut dysbiosis is corrected, and you'll be shocked at how they just reverse.
What are some of these tests that and I actually second you on tests. And yesterday we had two great cardiologists, we had an oncologist, and we were talking about this, the need to test children if required.
Yes.
And like two of them said, even if someone's 3 years old,
yes,
we're better safe than sorry.
I agree.
If we're not doing a random test, but we're searching for something, and I would do a test today on a 5, 6, 7 because we are finding D3 deficiency and B12 almost in every child.
I'm so
which
glad
affects
you.
their puberty and everything else.
I'm so glad you brought this up. You know, one of my child is very picky. He's a picky eater, and I wouldn't understand what was going on. And I was fortunate to actually have this discussion with a person who's also a functional practitioner, and you'll be shocked at what I understood out of it. A zinc deficiency in a child can significantly affect their sensorial ability and how they handle sensory stimulation. And when they eat, they are not liking the taste, and just adding zinc can actually help picky eaters. So, but that's not something you can supplement till you know the deficiency, right? And half the kids are deficient on vitamin D. So these minerals play such an important role, and that's the same thing that happens even in these young girls who are having PCOD. If you don't detect their insulin resistance, and not everything has to be treated with a contraceptive or an androgen blocker. But going back to your blood levels is that PCOS can be related only to your female hormones, where it will reflect with your levels of your LH, your FSH, which triggers your ovaries to release your estrogen and progesterone. But sometimes it could be very androgen dependent, where you have to check your testosterone. And you also have to check the precursors to understand whether the DHT or the DHEA is getting aggravated. But what I also like to look at now in a lot of kids is leptin, as I said, with their insulin, and sometimes just map their stool. So stool test can actually be very significant to show you a gut dysbiosis, because your estrogen is getting pushed out of your gut. And if that is not happening, so a simple test like looking for a beta glucuronidase can help. Of course, these are advanced testing and should be done when there is a significant non-improvement in the case. But as a parent and as a dermatologist, I encourage other people to start detecting it at the root level and not just treating it with creams. Because, decreasing foods with high glycemic index, adding something as simple as, foods which would help with berberine, or encouraging more of activities which like apple cider vinegar, right? Which can be added in salads, which can be given as in a glass of water. These can all significantly improve the way your insulin is responding. And insulin resistance, once corrected, can reverse PCOD. So it's not something that you live with. PCOD is a result of that insulin resistance or leptin resistance.
Yeah, absolutely. We've seen complete remission cases of PCOD.
100%.
They've made lifestyle changes and they've addressed it medically as well.
Yes.
But that's the thing, the mentality in our country, a lot of people believe that once you have it, you have to live with it. So young girls grow up thinking that, this is part of my life. So let's move to creams. Let's move.
Exactly.
They don't understand that they can get better if they make the right
And
changes.
the problem is that now we are seeing a lot more cases of lean PCOS. So they don't come to you with the traditional trio of having a PCOD. They're not typically high in fat in their centripetal area. There's not necessarily abnormal hair growth. There's not necessarily a change in their menstrual cycle. So a thin person could still be insulin resistant or could still be having a hormonal imbalance. And I think that's when it becomes very important to start testing and understanding. And not all PCOD cases will show you that cystic pattern in your ovaries. So maybe your every sonography will not say necessarily that you're PCOS, but you could be on the symptom of it. And I feel it's important to treat it then. It's much easier when you start preventing something rather than treating a full onset of a disease.
I agree with you. And I also want to go back to your point of, this whole estrogen recycling in the body. It has its pathways, the liver, and of course, your stool.
Yes.
And we have seen a clear commonality in constipated, chronically constipated girls and women, and they have dark skin, but they want to do IV glutathione, and they want to do all of these things. And we've seen it in patients with grade 2 fatty livers, grade 3 fatty livers, and constipation. And they have an estrogen buildup in their body, and they don't realize that these two pathways have to first be clear.
I'm so glad you brought that up, because it's one of the earliest ways you can pick it up. Because, it's not just about high estrogen. It's about its transport. It's about how it's getting excreted. And for a woman's body, it goes through these phases multiple times. So it's very important that it is picked up at the correct time. And it's what you said, right? With dark skin, you'll be shocked how many times you will also pick up an autoimmune disorder happening at the same time with estrogen dominance. And very quickly, you'll see that these patients are presenting with a typical Hashimoto's. So maybe the thyroid profile is not showing it, but if you've not checked for the thyroid antibodies, you don't know. Yes, the patient is setting in. So at this time, simple dietary changes, like being careful of your nightshade vegetables, avoiding histamine releasing foods, you can actually decrease the inflammatory spectrum, because this will further manifest with brittle nails, hair loss, dark skin, dull appearing skin, mood swings. So it's just always all correlated. So it's never enough to just treat the single cause without really finding out where foundationally is the problem occurring. And I feel that with young girls, if you start early and introduce them to the right and healthy, and I say that because it's very important in today's generation where we believe in intermittent fasting or we believe in one meal a day. Why I say healthy is because the right amount of protein from the right age becomes absolutely essential for the way you will age.
I love that you brought that up, because this fasting has also become a fad. While of course, absolutely, I have super fit and healthy people doing a OMAD, one meal a day.
Yes.
It's not for everyone.
No, it's not for everyone. And I'm so glad you say that, because I also believe that intermittent fasting is good, but it's not for everyone's body. Because if your body is not responding to it, you are actually making it worse. It's going to start storing fat for the future. And that fat is what is going to release leptin. And when there's excess of leptin in your body, it's going to be leptin resistance. And then again, the whole cascade, right? Of early menopause, perimenopausal changes, all of it just starts. So it's very important to understand what works for you.
Yeah, we've seen it with thyroid patients. We cut down their fasts from 18 hours to 14 to 12. And sometimes just doing a 12-12 is the baseline. And it's just actually great for the human body.
Yes.
And then we slowly increase it because we've seen thyroid patients, Hashimoto's patients are responding better to lesser fasting hours, more consistent, gentle exercise than extreme exercise.
Yes.
So their cortisol spikes are coffee after coffee after coffee. They never reach a baseline of homeostasis in their body.
Luke, I'm so glad you brought this up because a lot of people now are looking at the cortisol response in the body, right? And how your cortisol is moving up and down. And I think ashwagandha became really popular because of that. And I truly believe that ashwagandha works. But again, these are herbs which should be understood if your body needs, and there are timings of the day where it should be administered, because if you don't monitor your cortisol the way it needs, there are times when your cortisol should be high. You can't be at a flat curve the whole time, because otherwise tomorrow if you were to meet an accident, the body wouldn't respond, right? The cortisol is what is helping you, but taking supplements at the right time becomes very important, and also knowing what else works. So rhodiola actually works better to help with your...
That absolutely, and scientifically, it works way better than... And ashwagandha, we noticed this, and that's what made us deep dive, because people started using it just pathogen.
That's why I brought it up, because there are coffees which are there with ashwagandha and lion's mane, and you need, and I'm not saying they're bad, but the thing is,
don't suit everyone.
Exactly, and the timing of consumption becomes important, because it should not set off the response in the wrong way.
I love your medical view on this, because ashwagandha, my biggest worry for most people is the numbing effect. When they stop it, they're just like,
flat curve.
Yeah. And that's not good for them. They don't have a cortisol response, like you said, which can actually, it's working with your heart. Your heart's trying to keep you alive. It will create cortisol spikes when it needs more blood flow, when it needs more pump, or if we're in a stressful situation, our pressure rises. But people don't understand that these biohacks are actually numbing the natural intelligence of the body.
Yeah, and I think why it's important to me as a dermatologist is because all of this is related to aging. Aging is happening at a cellular level way before it's manifesting on your skin. So when you are talking about, I don't like the term, but when you're talking about anti-aging, it's all about halting the aging process or monitoring it in a healthier manner at the cellular level. And that has to start with a hormonal symphony that works in your favor, the lifestyle that works in your favor, and of course your circadian rhythm.
Absolutely.
Because if your glands are not triggered at the right time, like if basic sunlight doesn't hit your eye, your pineal gland doesn't know it's morning. It doesn't know that now I'm supposed to start preparing for the rest of the day. And all these factors will contribute eventually to aging. So when somebody tell me the top 3 supplements for anti-aging, I'm like, sleep, handle stress better, and eat better. Because honestly, if you just get this correct, everything else will fall in place, and that's when it will work. There will be 2 people who use retinol, and one person will still appear healthier than the other, and that could be not because the cream is suiting them better, because that person is just making healthier lifestyle. Exactly. So it's never one treatment which is the result, It's always the mix of everything and coming together.
Doctor, thank you so much. This is so valuable. Before we end, what message would you love to leave for our audience? We'll have children, we'll have teenagers, we have senior citizens, a lot of your patients as well watching this. So over the last couple of months, I mean, we're always learning. I appreciate you because you're always learning. There's always something for all of us to learn. What message would you like to leave all of us?
I think as a generation, we should look towards longevity as the new medicine and understand truthfully that longevity lies at a very deep cellular level and it's in our control. So it's something that gives you a lot of power to understand that you can modify the way you will age by making the right choices. And I say this to a lot of the young girls who are making wrong choices by using products too early, that it's in your hand to have a healthy skin that will age beautifully if you just use the products that are needed at the right time.
That's amazing. I will take your time to do a 30-minute special for men.
Of course, I look forward to it.
Have those questions, and it's a new space.
Yeah.
It's a new space. And I see some men trying to copy women, they're doing this, and I'm assuming we're very biologically different, so there'll be a different protocol.
Of course.
So we would love to have you on our show.
I'd love to
address just men in particular, young boys maybe in particular.
And honestly, I think the issues that we touched upon with leptin and insulin and some of the hormones, men are facing it as well. So next time when we chat, I think we'll get into depth about that.
Absolutely. I would love to talk about hormones and skin for men. Thank you so much, Doctor.
My pleasure as always.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.